All right, so ready for your daily dose of healthcare news?
Sounds good. Always ready for that.
Awesome. Well, we've got headlines on everything today. Hospital mergers, AI, and even some news about a potential bird flu pandemic.
Yeah, there is a lot to unpack.
There is. Let's jump right in. First up, some big people moves. Francis Collins, a pretty prominent guy at the NIH, has retired.
Oh, wow. Really?
Yeah, and this comes right as the NIH is dealing with budget cuts and layoffs.
Interesting. You know, Collins was a huge advocate for genomics research, so I wonder if with him gone and the NIH facing, financial constraints, we might see a shift in research priorities.
That's a good point. What kind of shift are you thinking?
Well, it could impact the development of personalized medicine, for example, treatments that are tailored to your genes.
Oh, that's interesting. Makes you think about the future of personalized medicine.
Yeah, for sure.
On a different note, NYU Langone Health is actually expanding. They just got their seventh hospital through a merger with Long Island Community Hospital.
Hmm. It seems like we're seeing a lot of consolidation in healthcare these days.
We are.
As these healthcare systems face financial pressure, mergers can, I guess, help them save money and increase their market share. But I think we need to think about what that means for patient care and access.
Absolutely. It's a good thing to keep in mind.
Hmm.
So we've got leadership changes at the national level with the NIH and this consolidation trend playing out locally.
Right.
And speaking of local, Sarasota Memorial Healthcare System just appointed a new CFO, Jen Rosati. She comes from a local bank where she worked for years, so she's got deep ties to the community.
Oh, cool. It'll be interesting to see if that background influences the organization's financial decisions in any way. Maybe she'll bring a different perspective.
Yeah, that makes sense. All right, let's talk AI. It feels like it's transforming healthcare in some pretty big ways.
It is. It really is.
Black Book Research just reported a huge increase in the use of AI-driven virtual care platforms. We're talking remote patient monitoring, virtual hospitals, the whole nine yards.
That makes sense, right? I mean, think about the pandemic's impact. Telehealth and virtual care became, well, essential, and AI is making those platforms even better. Automating tasks, analyzing data, even personalizing those patient experiences.
It's amazing to see how fast this technology is developing. And it's not just virtual care either. Even primary care physicians are turning to, get this, ambient AI assistants to help with burnout.
Wow, really?
Yeah, these AI systems can actually listen in on appointments and handle all those documentation tasks.
That's incredible. It shows how AI is being used to try and solve this really big problem of physician burnout. If they can reduce all those administrative burdens, it could really free up doctors to, spend more time with patients and focus on making those clinical decisions.
Right, that's the hope. But you mentioned earlier the potential for bias with AI. There was a recent survey that found that like 61% of doctors are actually worried that AI could increase prior authorization denials.
Oh, yeah, I saw
Do you
that.
think they're overreacting, or is this a real concern?
I think it's a valid concern. I mean, look, if the AI systems being used for prior authorizations are trained on data that reflects existing healthcare inequalities, then yeah, it could definitely make those disparities even worse. The people developing these systems need to be really careful to make sure those algorithms are implemented ethically. They need safeguards against bias.
That makes sense. So again, this AI thing, it's kind of a double-edged sword. Huge potential for good, but also potential pitfalls.
I think that's a good way to put it.
Okay. So speaking of potential pitfalls, let's talk about funding and innovation. We saw 5 health tech companies get some big funding in February, but at the same time, these retail giants are, well, they're struggling with their primary care ventures.
It's interesting, right? It just shows that having money to invest doesn't guarantee success in healthcare. It's such a complicated industry.
It is.
Applying a retail model doesn't always work, and maybe they underestimated just how complex healthcare can be.
Yeah, that's possible. They might be having trouble integrating with existing healthcare systems or just not meeting those specific needs of patients.
Right, exactly.
Okay, so let's shift gears a little. We want to talk about access and disparities. There's a big push right now to expand access to clinical trials
Oh, yeah, absolutely.
and, you know, address DEI challenges,
Hmm.
making sure that trials are representing diverse patient populations.
It's really important. I mean, we've seen the consequences of a lack of diversity in clinical trials.
We have.
You end up with treatments that aren't effective for everyone or could even be unsafe for certain groups. So getting DEI right in research is absolutely critical. Medical advancements should benefit everyone equally.
Absolutely. And on that note, some states are facing some serious doctor shortages. And they're thinking about relaxing those licensing rules for foreign-trained physicians.
Interesting.
But of course, that raises some concerns about, are we lowering training standards?
Yeah, that's a tough one.
It is.
I mean, on the one hand, relaxing those rules could help fill those gaps in care, especially in places that really need it. But on the other hand, we need to make sure we're maintaining those high training standards. We can't compromise on patient safety and quality of care. It's a tricky balance.
For sure. So while we're talking about healthcare challenges, there's a new report out about a program that helps modify homes for seniors who are aging in place.
Okay.
The problem is Medicare rarely covers these costs.
Oh, that's a shame. I mean, helping people age in place is such a good idea.
Yeah.
Improves their quality of life, could even save money on healthcare costs in the long run.
It could, but without that Medicare coverage, a lot of people who could really benefit are, well, they're left out.
Right. Okay.
Well, let's jump into the political side of things. The Trump administration proposed some cuts to USAID, and this could really threaten some global health initiatives.
Oh, wow.
Yeah, we're talking about programs for HIV treatment and prevention, tuberculosis, all kinds of vital health services around the world.
Yeah. These political decisions have real-world consequences, don't they?
They do. And speaking of political decisions, Republican lawmakers are taking aim at Medicaid spending. They want to cut the budget.
That's concerning.
Yeah.
So many people rely on Medicaid for health care.
Millions.
Any cuts would have a huge impact, especially on low-income folks and people with chronic conditions.
Yeah, it's something to watch closely. And finally, let's talk about bird flu. There's a growing concern about a potential outbreak, even a possible pandemic.
Ugh, that's not what we need right now.
It's not.
We really need to be prepared and make sure people have the information they need. We learned a lot from COVID, and we've got to apply those lessons here.
It's a reminder that we can't let our guard down.
No, not at all.
So that's a lot to process.
It is. Healthcare is always changing.
It is. And we'll be here to break it all down for you.
Yeah, it's a lot. And there's even more. We're also seeing activity in the medical device industry. Boston Scientific just announced that they're buying Sonovi. Yeah, they're developing a new ultrasound system to treat, high blood pressure.
Oh, so it's not just hospitals merging. Medical device companies are getting in on the action, too.
Right.
What makes this acquisition so important?
Well, this technology, they call it renal denervation. It's a procedure, minimally invasive. They use ultrasound to, target these nerves in the kidney that contribute to high blood pressure. It could be a game changer, especially for patients who don't respond well to medication.
Wow.
Oh.
So it's a pretty cutting-edge alternative. I can see why Boston Scientific would be interested. But, hey, not all the news is about growth and expansion. Kindred Hospitals is actually closing its Bay Area Tampa location.
Oh, really?
Yeah, they're consolidating services.
Hospital closures are always tough. It means fewer options for people in those communities and often job losses, too.
It's a reminder that these decisions affect real people's lives. On a brighter note, Rush University System for Health in Chicago just appointed a new system VP of Revenue Cycle, Blake Evans.
Okay. Revenue cycle management is so important for hospitals, right? It's all about optimizing how they bill and collect payments.
Right.
So strong leadership there can really make a difference for a hospital's financial stability.
It's the backbone of the business. And speaking of financial stability, Mayo Clinic is putting down some serious cash. They're investing, wait for it, $1.9 billion to expand their Phoenix campus.
Wow, $1.9 billion. That's a big commitment to Arizona.
It is.
It'll be interesting to see what kind of impact this has on healthcare there. I mean, they could attract even more patients, maybe even drive some innovation in medical research and technology.
It's a big bet on the future of healthcare in that region. But unfortunately, not all healthcare news is positive. In Tennessee, a gynecologist was just indicted for allegedly abusing patients and reusing unsanitary medical devices.
Oh, that's awful. These stories are always so disturbing.
They are. It just highlights how important patient safety and ethical conduct are in healthcare.
You're absolutely right. We can't lose sight of that.
Absolutely. Okay, let's talk about partnerships and collaborations. WVU Medicine just appointed a new CEO for their Uniontown Hospital in Pennsylvania, Karen Wallace. She'll start in June.
Cool. Leadership transitions are always interesting. I wonder what direction she'll take the hospital in.
Every leader brings something different to the table. Speaking of vision, Duke Health and Novant Health in North Carolina are teaming up. They're building new campuses across the state.
Oh, wow. That's a big project.
It is.
It seems like we're seeing more partnerships like this. They can pool resources, share expertise, and ultimately reach more people and offer them a wider range of services.
It's about working together to make a bigger impact. And in Cleveland, Metro Health is doing some great work. They're trying to increase the number of women in cardiology.
That's awesome. Cardiology has always been, I don't know, a pretty male-dominated specialty, so it's great to see them pushing for more diversity.
It's important. Diversity in leadership brings new perspectives and experiences, which benefits everyone.
Couldn't agree more. Diverse teams tend to be more innovative and better equipped to meet the needs of, a diverse patient population.
For sure. All right, back to technology. Google Cloud is expanding its AI-powered search tool for healthcare.
Oh, yeah. What's new?
They've added the ability to search through images.
Cool. That's a big step for multimodal AI. Being able to analyze images along with text, it could really change how doctors make decisions.
Yeah, imagine being able to search for similar medical images or spot patterns in, all that imaging data. It's like having a superpowered research assistant for visual information.
That's a good way to put it. And speaking of AI, Microsoft just launched a new AI-powered clinical workflow assistant.
Another one?
Yeah. They call it Dragon Copilot. It's designed to help streamline all those tasks that take up so much of a doctor's time. Documentation, finding information, even scheduling.
It could be a game changer for busy clinicians.
Yeah.
But technology isn't always perfect, right? Geisinger, a health system in Pennsylvania, is dealing with a data breach.
Oh, no. What happened?
Personal information from over 1.2 million patients was found on a former contractor's laptop.
That's scary. Data breaches are a huge concern in healthcare. It just highlights how important it is to have strong cybersecurity measures in place.
And to be constantly vigilant about protecting patient information.
Absolutely.
Shifting gears, the FDA just announced some new labeling changes for all testosterone products. They're adding warnings about potential risks.
Oh, really? What kind of risks?
Blood pressure and cardiovascular problems.
Okay. Testosterone therapy is pretty common, but there have been, some concerns about side effects. So it's good that they're making this information clear to both patients and doctors.
It's all about weighing the benefits and risks and making informed decisions. While the FDA is focusing on testosterone, Ascension, a large healthcare system, is celebrating.
What are they celebrating?
They've managed to reduce risk-adjusted mortality rates by over 20% across their hospitals.
Wow, that's amazing. Reducing mortality rates like that takes a huge effort.
It does. It requires system-wide changes, focusing on quality improvement, patient safety, and early intervention.
Definitely.
So, kudos to them. Now, for something a little different, a new Wallet Hub study just came out. It ranked Massachusetts as the best state for women.
Oh, interesting. What about the worst?
That would be Mississippi.
I wonder what factors they considered.
Things like healthcare access, economic opportunities, political representation. It's kind of a snapshot of gender equality and well-being for women in different states.
That makes sense.
And in a nice gesture, Tampa General Hospital in Florida just opened a new primary care clinic specifically for military veterans and service members.
Oh, that's great.
Yeah, it's a way to recognize their service and make sure they get the care they need.
I like that.
Meanwhile, Aspirus Health is building a brand new hospital in Chippewa Falls, Wisconsin.
Wow. New hospitals are always a good sign, right?
They are. It shows a commitment to meeting the healthcare needs of a growing population. It's like a symbol of hope and investment in the future of healthcare in that community.
Yeah, exactly. And across the pond, the UK government and the British Medical Association just reached an agreement on some GP contract reforms.
Oh, what are they changing?
Well, the goal is to improve access to primary care within the National Health Service. So they're increasing funding and putting in some measures to support GP practices.
So it's another example of healthcare reform in action.
Yeah.
Complex, but hopefully with positive results.
Hopefully.
Back in the U.S., Prime Healthcare just acquired 8 hospitals in Illinois.
From who?
From Ascension.
Oh, wow. That's a big shakeup for Illinois healthcare.
It is.
Prime Healthcare has a reputation for, turning around struggling hospitals.
Right.
It'll be interesting to see how this all plays out.
For sure. Okay, it's good news on the flu front. The CDC says that the worst flu season in over a decade might have finally peaked.
Phew, that's a relief. A bad flu season really puts a strain on the whole system.
It does, and it's a good reminder to stay on top of those preventive measures.
Right. Washing your hands, getting your flu shot, all that good stuff.
Okay, in the world of medical technology, Sysmex America just launched a new hematology analyzer.
Ooh, tell me more.
Well, it's a 3-part differential automated analyzer. Basically, it'll make blood cell analysis more efficient and accurate.
Nice. That means doctors will have better information for diagnosis and monitoring?
Exactly. Technology is always evolving to make things better. And speaking of evolving, Ansell, a global safety solutions company, just expanded their healthcare portfolio.
What did they add?
3 new brands: Kimtech, CleanGuard, and RightCycle.
So they're focusing more on personal protective equipment and infection control.
Makes sense after everything we've been through with COVID?
It does.
Okay, get this. There's a new HoloWare system that's supposed to be a game changer for healthcare data analysis.
Really? What's it called?
It's called CubeWare 2.0. They say it'll make things more efficient for healthcare professionals and, get this, it's also way better for the environment.
Oh, cool. They're hitting two birds with one stone. What's so special about it?
Well, it's designed to save space. It's got these tactile indicators for more precision, and it's made from completely recyclable polypropylene. Plus, it's climate neutral.
Wow. It sounds like they really thought of everything.
It's a great example of how healthcare companies can prioritize both patient care and environmental responsibility.
It is.
Okay, quick update on Amwell, the telehealth giant. They just appointed a new Chief Product and Technology Officer, Dan Zamansky.
And where's he coming from?
Amazon Web Services.
Oh, interesting. That's a pretty big move for Amwell.
It is.
It'll be interesting to see what he brings to the table, maybe a focus on cloud-based solutions or, integrating more AI and machine learning into their platform.
Yeah, it sounds like they're gearing up for even more growth in telehealth. Okay, let's talk about sensor data and how it could change diabetes care.
This is exciting stuff. I mean, think about all the data we can get from wearable sensors now, like those continuous glucose monitors.
Like a constant stream of information.
Exactly. And we can use that to personalize diabetes management, help people control their blood sugar better, and hopefully prevent complications down the road.
It's all about being proactive and tailoring treatment plans to each individual.
It's amazing what technology can do.
It is. But of course, there are challenges too.
Like what?
Well, data privacy is a big one. And we need to make sure that everyone has access to this technology, not just those who can afford it. We don't want to make health disparities worse.
You're absolutely right. We need to be mindful of those issues.
Okay, a new report just came out highlighting the potential impact of those expiring Affordable Care Act marketplace subsidies.
Oh, yeah, that's a big deal. Those enhanced tax credits helped a lot of people afford health insurance.
Millions.
If they expire, a lot of folks could lose their coverage, especially people with lower incomes.
It's a reminder that access to affordable health care is still a major issue.
It is.
And there's a growing push for better consumer protection in health insurance.
What do you mean by that?
Well, making sure that patients understand their coverage, you have access to clear information, and that they have options if they're unfairly denied coverage or can't get the care they need.
Oh, okay, so it's about transparency and accountability.
Exactly. And speaking of transparency, the National Health Service in England is working on a new patient charter for GP practices.
What's that?
It'll outline what patients can expect from their GPs in terms of access, communication, and quality of care.
So they're really trying to put patients first and make things more transparent.
It's a good step towards more patient-centered care. But while the UK is trying to improve GP practices, there's a senior doctor over there, likely to be the next chair of NHS England, who's raising some concerns about moving services into the community.
That's interesting. It goes against the trend, right? I mean, there's this big push to move healthcare out of hospitals and into those community settings.
There is.
But it's not always easy. It takes a lot of planning and resources, especially when you've got, tight budgets like the NHS.
It's a balancing act, for sure, weighing those priorities and making sure the needs of both patients and providers are met.
You've got to find that sweet spot, right?
Mm-hmm.
To create a healthcare system that's both effective and sustainable.
Absolutely. Okay, speaking of sustainability, the National Committee for Quality Assurance, or NCQA, just released some proposed updates for HEDIS.
HEDIS?
Yeah, those performance measures that a lot of health plans use to evaluate the quality of care at hospitals.
Oh,
These updates are for measurement year 2026.
Okay, so what are they changing?
Well, they're adding some new metrics and focusing on things like digital health and social determinants of health.
So they're really trying to keep up with the times and make sure those quality measures reflect the changing healthcare landscape.
They are. It's all about constantly improving how we measure and ultimately improve the quality of care.
Makes sense.
All right, this next story raises a really interesting ethical dilemma. There's a study suggesting that when there's no treatment for a life-threatening disease, telling patients their diagnosis might actually do more harm than good.
Wow, that's tough.
It is. Knowledge can be powerful, but in some cases, it can also lead to despair and even negative health outcomes.
Yeah, I can see that. It puts doctors in a really difficult position. They want to be honest with their patients, but they also don't want to cause unnecessary suffering.
It's a reminder that healthcare is about more than just delivering information. It's about providing compassionate care and support.
Absolutely.
On a more positive note, Community Health Systems just completed the sale of ShorePoint Health System in Florida.
Okay, and what does that mean for the community?
Well, it's good news for the residents in Port Charlotte because it means they'll still have access to care.
That's great. It's good to see these deals prioritize those community needs. Access to quality care is so important.
It is. And sometimes we forget that behind all those headlines and, financial transactions, healthcare is really about people and their well-being.
Right.
Speaking of people, there's a great story about community health workers.
Oh, I love those folks. They do such important work.
We do. They're the ones connecting communities to healthcare resources, providing education, offering support. They're really addressing those social determinants of health.
They're like the bridge between the healthcare system and the people who might, otherwise fall through the cracks.
Exactly. And we're seeing more and more recognition of the importance of integrating those social determinants of health into clinical workflows.
That's huge. I mean, we have to understand that health is about more than just medical care. It's about those social and economic factors, too.
It's about looking at the whole person, their entire context.
I like that, looking at the whole person.
And technology can play a role here, too. Medicare's remote physiologic monitoring program is helping to reduce costs and improve outcomes for patients.
Oh, how does that work?
Well, doctors can monitor patients' vital signs and health conditions remotely. So it allows for more proactive care and, they can intervene earlier if something's wrong.
That's great, especially for people in rural areas or, places where access to care is limited.
Exactly. It brings healthcare right into people's homes.
I love that.
Okay, there's a big push right now for more inclusive communication in healthcare.
Oh, yeah. That's so important.
It's about making sure that all patients understand their health, their treatment options, and their care plans. No matter what language they speak or, their cultural background.
It's about building trust and making sure everyone feels heard and understood.
Exactly. And speaking of challenges, there's a new report out about doctor shortages.
Oh, not surprised. It seems like we hear about that all the time.
It's a big problem, especially in rural areas. Some states are thinking about making it easier for foreign-trained physicians to get licensed, but that raises concerns about, are we lowering standards?
Yeah. It's a tough one. We need more doctors, but we also need to make sure they're qualified and, that patients are getting safe and effective care.
Right. It's a delicate balance. And food is back in the news. There's a physician and culinary medicine specialist who's advocating for, putting more emphasis on plants and healthy beverages in those dietary guidelines.
That makes sense. I mean, we all know that what we eat has a huge impact on our health.
It does.
Yeah.
A balanced diet can prevent and even manage a lot of chronic conditions.
It's true. Food is medicine.
It is. And speaking of prevention, there's a renewed focus on measles vaccination.
Oh, why is that?
Cases are starting to rise in some areas.
Oh, that's not good. Measles is a serious disease.
It is. And vaccination is the best way to prevent it. Doctors need to keep talking to their patients about the importance of vaccines and, address any concerns they might have.
Absolutely. We can't let those preventable diseases make a comeback.
And on that note, there's growing concern about a new COVID variant.
Oh, really? Another one?
Yeah, it's been detected in a few countries.
It's a reminder that this pandemic isn't over yet.
It's not.
Yeah.
We need to stay vigilant and keep doing those things that help protect us, like getting booster shots and, those basic preventive measures.
You're right. We can't let our guard down.
Okay, last but not least, healthcare organizations are teaming up with law enforcement to improve safety in medical practices.
Oh, that's good. I mean, there have been so many incidents of violence in healthcare settings.
It's scary. So they're focusing on things like, better visitor management, security measures, training staff on how to respond to threats.
It's about creating a safe environment for everyone, both patients and staff.
Exactly. And finally, the American Hospital Association is calling on Congress to do something about the workforce shortage in healthcare.
Yeah, that's a huge problem.
It is. Hospitals and health systems all over the country are struggling to find enough nurses, doctors, and other healthcare professionals.
It's a crisis.
It is. And the AHA is pushing for policies that will support workforce development, recruitment, and retention.
We need to invest in our healthcare workforce. They're the backbone of the entire system.
They are. And without enough qualified people, we can't deliver quality care.
It's that simple.
It is. Well, that was quite a rundown of healthcare news. It's amazing how much is happening, isn't it?
It is. From those big advancements to those everyday challenges, it's a constantly changing landscape.
It is. And we're glad you joined us for this deep dive. What really stood out to you from today's news?
For me, it's the innovation. All the amazing things people are doing to improve healthcare, from those AI-powered tools to new ways of delivering care. It's an exciting time to be in this field.
I agree. It's inspiring to see the dedication and, just the sheer ingenuity of everyone working to improve health and well-being. But we still have a lot of work to do, right?
We do. Those health disparities, workforce shortages, rising costs, those are big challenges.
They are. And they require all of us to work together to come up with creative solutions and to always, always put patients first.
That's what it's all about.
It is. So, as the healthcare world keeps changing, what role will you play in shaping its future? Whether you're a patient, a provider, or just someone who cares about healthcare, we all have a part to play in creating a system that's equitable, accessible, and innovative. Thanks for listening to this deep dive into healthcare news. We'll see you next time.